All right. Good afternoon and welcome to Arkansas Children's. We are live and you can tell it looks a little different. We are doing our first Facebook Live remote, and Dr. Jennifer Aunspaugh at Arkansas Children's Northwest is our first guest. So Dr. Aunspaugh, thank you for joining our first remote live from Springdale, Arkansas.
Thank you for having me. I'm happy to always get on here and talk about Children's Northwest.
Yes, we want to hear a little bit about you and your role at Arkansas Children's Northwest. But first, for people who are just now tuning in, we are going to be talking about Surgery Day for your child. And as a parent and the parents who are watching, it can be a nervous day. And there's a lot of expectations, and you might have a lot of questions and concerns. But thankfully, we have a team of pediatric experts who specialize in pediatric anesthesiology, and they know how to care for your child, and it's right size care at Arkansas Children's and Arkansas Children's Northwest. So Dr. Aunspaugh, tell us just a little bit about your role at Arkansas Children's Northwest and what your favorite part is about working at a children's hospital.
Well, I am the director of pediatric anesthesia at Arkansas Children's Northwest, and I also serve as the chief of staff for med staff services here. And probably a most favorite thing about working in a children's hospital is it's always a happy place, really. It's always cheerful. There's always lots of color. And when the kids come in, we just try to make it as fun for them as we can, and lots of play and lots of make-believe, and for those who are young enough to make believe with us and play along. But I think, they're so innocent, and they just, they come in scared, and our main goal is to make this place, make them feel safe and not make them feel so scared.
At a children's hospital, we're not just taking care of the patient. We're taking care of the whole family. So these
Right.
children come with parents and grandparents and caretakers. So for parents who are watching and caretakers who are watching, caregivers, what can they expect for the day of surgery at Arkansas Children's Northwest?
Well, depending on your surgeon, they'll give you instructions on what to do. And so at Arkansas Children's Northwest, everyone comes in a few hours before the procedure, and everyone is checked into their own room in the preoperative area. All the family, we can't have everyone back in those areas, but we try to get as many as we can. But we really just try to make everyone feel comfortable. We're explaining everything we're doing to the kids and to the parents, and really trying to build their trust. And just know that we're going to have child life specialists that are going to come by and see your child. You're going to have a preoperative nurse who will be there preoperative, and she may be the same one that takes care of you postoperatively too. So there's going to be a lot of people that will see your child on the day of surgery, and it's all meant to just make them feel safe and make the experience not so scary, and to also build the trust with the parents.
Excellent. I love hearing about the care team that is taking care of your child, and knowing there are different policies and procedures at Arkansas Children's in Little Rock and Arkansas Children's in Northwest. So keep those in mind, depending on where your child is a patient. Let's talk about how anesthesia is different at a children's hospital. Is it given different? Is it different amounts? What makes it special?
Well, it's kind of like you said earlier, it's the right size care. We base all of the administration of anesthesia based on their weight, the child's weight and their size. Not every child gets the same amount across the board. And so another way that's different is that a lot of times children are not going to tolerate having an IV placed before they have surgery. It's kind of a scary, painful procedure. They don't want to do that. And so we offer the ability for them to breathe the anesthesia gas through a mask. And the masks are all flavored, so they smell like something, like gum or candy. A lot of times we'll call it the candy air, and that's how they'll breathe it. And then once they're asleep, they'll get their IV placed, so they don't feel any pain. And so that's a little bit different for a children's hospital compared to adults. In adults, we all just go in there, we get our IV no matter what, and that's the way it goes. But at the children's hospital, we have that advantage. We can postpone the IV placement until they're asleep. There's times when we allow parents to be present with our patients as they go to sleep. And one thing that's different about Children's Northwest is that we have induction rooms, which are rooms that are attached to the operating room. And those rooms are specifically dedicated to the children to be induced under anesthesia, which means to give the administration of anesthesia and start that whole process. And we have a TV in there where we're always playing cartoons, and we have little toys, and I have the best nurse anesthetists, and they'll sing songs, and we just try to make it a very light and fun experience, and we'll tell stories, and it's a great opportunity for parents to be there as well, because there's been a lot of research around parent-present induction that supports the parents being the last one that their child sees, that usually they wake up a different they're not as upset, they're not as irritable, they wake up a little bit calmer. And we've had a lot of good feedback from the parents as well that say they were glad that they were able to be there for that process. It might have been hard for them, but in the end, they were glad that they were there.
So along those lines, I love to hear about the parent-present induction. When your child does wake up from anesthesia, what are some common symptoms, and what could parents expect their child to act like?
Sometimes when children wake up from anesthesia, they're very irritable, and that is really par for the course with pediatric anesthesia. There are times when children wake up and they're just as peaceful and calm and everything's fine. We give them a popsicle or a slushie and they're happy. But there are some times when they are irritable, they don't understand what's happened, they're still feeling funny from the gas or from the anesthesia, and so they're a little bit frightened. So I just encourage parents, to don't be afraid, don't think that there's something horribly wrong. I encourage a lot of the parents to understand that it's par for the course a lot of times. And it depends on the child. It depends on how they were when they went to sleep, what sort of state of mind they were in. And it also depends on the surgery as well. But we're always going through and trying to rule out, is this pain related? Is there anything that we could be doing to make this different? But yeah, and so sometimes it's a child being upset and crying, and sometimes it's
Excellent. Just along those lines, we're talking about a smooth surgery day. So what are some things that parents can do themselves? We know how you're taking care of the patient, but what can parents do to prepare themselves for surgery day?
Well, I would encourage you to really just try to stay calm for your child. Because if they see you nervous and upset, then that's going to make them just as nervous or even more nervous. So I think it's very important for parents to stay calm. And I encourage you to really tell your child what's going to happen. Because if they come here and they don't understand, that can make it an even more frightening experience for them. So I encourage parents to explain to your child what's going to happen when they come to the hospital and that sort of thing. And just to kind of tell them that we are not trying to hurt them, that, everyone is here to keep them safe, and that we're all nice people. But but the parents have a very big part in this. If they're calm and they're collective, and then the patients do so much better.
Has surgery day and preparing for surgery changed during the pandemic and COVID-19?
Oh, well, we now test everyone who has any sort of surgical procedure. So all of our patients who come in for their elective surgeries are coming at least 2 to 3 days prior to surgery and having a swab and having a COVID test. Anyone who comes through the ER or comes emergently from the inpatient unit, they have a test before they come to the OR. So it's a lot of COVID testing. And then those who are positive, we are using special filters, special rooms where we will start the anesthesia and wake the child up at the end. So a lot of protective measures for us as the caregivers and for the children, and then for equipment so that future patients aren't harmed. But those are some of the biggest things that have changed. But also, when we have parent-present inductions, for a long time, we could only have one child or one parent with the child versus having two, as we normally would when a child would go to sleep. And so we allowed parents to FaceTime with the other parent who wasn't there. And it made a huge difference in some of our kids. Some of them, I had one little boy that was really about to lose it, but then as soon as his mom got on there and he saw her and his face just lit up and he just went right to sleep. It was no big deal. So that's one way we've really tried to adjust and be flexible, is that kids really need, they really need both their parents if it's necessary. And so we've allowed a lot of FaceTiming. That's been good.
I love that idea.
Yeah.
Well, we appreciate your time. I know you said you just came from the operating room. So
Yeah.
you are busy taking care of children and patients and families at Arkansas Children's Northwest. So my closing question would just be the number one thing that you would want families to know about surgery day for their child.
The number one thing, just know that everyone in this hospital, we all have your child's best interest at heart. Anytime a parent leaves us after they've been with their child when they go to sleep, we always tell them we'll take care of them just like they were our own. And we really mean that. We are very dedicated to giving the best care that we can. We treat every child the same. No one's a VIP or whatever. Everyone's the same and everyone gets the best quality care. So just know that we are going to take care of your child to the best of our ability. Everything is going to be structured just for him or her. And we just want to make this as stress-free as possible on everyone.
Awesome. Well, thank you for everything that you are doing to provide right-sized care during surgery day for patients at Arkansas Children's Northwest. We do appreciate your time today. If you do watch, after you watch this Facebook Live and you have a question for Dr. Aunspaugh or about surgery at Arkansas Children's or Arkansas Children's Northwest, please leave it in the comments below and we'll make sure to get your questions answered. We also want to encourage everyone right now to get a flu shot. We are in flu season as we speak, so we want to keep everybody safe. So please get you and your family a flu shot and stay safe. Dr. Aunspaugh, thank you again for your time and everything that you are doing for patients and families. We appreciate your time.
Thank you. Thank you, Rebecca.
Thanks for watching.